If you don't have knowledge about lymphedema, definitely do your research if you're interested.
Okay, Queen. You're right. Something that regular viewers of Gorl World, a niche online community that revolves around viewing and judging super-sized, big, beautiful women, as they are called, very large, morbidly obese women, and an internet subculture that I am ultimately deeply fascinated by. Regular viewers of this community and this genre of videos, myself included, particularly those who follow the life and times of one Amberlynn Reid, are used to hearing the phrases, I have lipedema and I have lymphedema. But what does that mean, really? Because I have a Master of Public Health degree, not to brag, but big flex. I'm education mogging you. And I'm also volunteer fire department mogging you. I'm not sure if you can hear the siren. I'm Pennsylvania mogging you. I don't know. Do they do the volunteer fire department siren in other states? Because I had never encountered it until I lived in PA. And having grown up in Kansas, the first time I heard it, I flipped my absolute shit because I thought there was a tornado. I thought there was going to be a tornado. There wasn't. There was some sort of other emergency, but there was not a tornado. Anyway, I had never heard of lymphedema nor lipedema until I became utterly fascinated with Gorl World content. And like I said, I have a whole ass master's degree in public health from the University of Florida, and I am education mogging you. I'm public health mogging you at the very least. Nobody's more into this shit than I am. I'm so lame. So what are these two conditions? Because Amberlynn Reid is like literally constantly bringing them up, and it's like, well, what does that mean? What are you talking about? Because she says it. They'll be like, especially now that she's on Lol Cow Bus, which I spent like $70,000 on a master's degree, or somebody did. I guess it didn't come out of my pocket directly, although it will over time, which is why I'm starting making these videos. This is expensive stuff. And she's kind of like on Lol Cow Bus. God, they'll be like, oh, I was going to say I spent all that money on having a master's degree, and then I'm using it to talk about Lol Cow Bus. Mother, I hope you're proud. They'll be like, oh, Amberlynn, why don't you do whatever? Oh, Amberlynn, why do you do whatever? And she'll commonly respond with something about having lipedema and lymphedema. And I had to Google it. I had to educate myself. I had to do my research. I had to check my sources, etc. So, the whole reason I got a Master of Public Health degree was to make more money. But then the second reason that I got it was because I really enjoy health education, and I feel as though across my viewing of Gorl World content, but really across my consumption of popular culture in general, and especially on social media, there's a lot of health misinformation that gets spread, and I'm here to set the record straight. And in my personal life, I'm here to set the record gay. I'm not gay, but it's a funny joke. I'm a little gay. I mean, look at me. Anyways, let's start with lipedema, shall we? My notes are right here on my MacBook because I'm not a doctor. All right, I'm not the smartest person in the world. I'm the second smartest person. So, lipedema, were it to be broken down into parts, lip or lip is a medical term that you'll see to be used for fat, liposuction, your lipids panel, That would be where you would see that a lot. And then edema. Edema is the medical term for swelling in the body that's due to fluid trapped underneath the skin. So lipedema would be, excuse me, I have to touch my entire face. Lipedema would be swelling due to fat, essentially, trapped under the skin. Well, that doesn't make very much sense, does it? Because of course fat is under your skin. So hold on and I'll tell you what it really is, but I'm just trying to educate you in general. Be polite. So essentially, I should have you over here. Maybe I should have my MacBook right here. This is what I'll do. I'm just going to put my MacBook right here and, y'all can see it. I don't care if you can see it. I did a lot of research for this. I spent a whole evening researching lipedema and coming to understand lipedema. I loved it. It was fascinating stuff. So, lipedema is a condition where adipose tissue, which is the fancy word for fat, builds up in your body or in the patient's body, mostly in the legs, primarily in the legs, and sort of the way the Cleveland Clinic, I believe, described it was the area below the navel. So really just the lower half of the body. Your navel is your belly button. It builds up mostly in the legs. It can happen in the arms and the torso, but it's just not as common, unlike obesity-related fat buildup, which is distributed evenly, more or less, throughout the body. Lipedema causes fat buildup only in certain areas, as I just described, primarily for most patients below the navel, although it is possible as well in the trunk, which is your torso, and in the arms. That's quite an uncommon presentation. You will not see accumulation in the hands or in the feet. That's kind of a hallmark of lipedema versus obesity-related fat buildup. Per the Lipedema Society, lipedema typically does not impact the hands and feet. Like I said, I can tell you from my own personal experience as someone who used to be about 200 pounds heavier than I currently am, my fingers, which are still quite large, used to be way, way, way bigger. My hands and my fingers used to be much larger than they are now. And I also lost a shoe size when I lost all of that weight. I went from wearing a size 11 to wearing a size 10. Yes, I lost 200 pounds. Yes, I still got big ass feet. I can only do so. I lost a shoe size. But I think to lose another one, I'd have to cut off my toes, and I'm really not willing to do that. Lipedema is actually commonly believed to be caused by obesity among like the general public. I think a lot of people will see somebody with, especially within advanced stage lipedema, and assume that is simply obesity. But actually, lipedema is not caused by obesity. It's not known to be caused by obesity, rather. While most lipedema patients would be considered obese, about 85%, according to a study that was published in 2010 in the United Kingdom by researchers Child et al., about 85% of the lipedema patients that they surveyed were obese, which I believe obesity is BMI higher than 30, perhaps, or maybe it's BMI higher than 25. I don't remember. I can't know everything. I can only know most things. A similar study out of the Netherlands by a researcher named Bosman indicated 80% of their lipedema patients who participated in the study were classified as obese. And another broad European study by Birch indicated that as many as 88% of lipedema patients sampled were obese. So there's a correlation there. But there is not a known causation, and that's important to know that there is a difference. There is a difference, especially when it comes to the health sense and the medical sense, between correlation and causation. So we have the correlation between lipedema and obesity, but there is not a known causation either way. A separate study that I Oh, and a more recent study as well. Recency does matter. A separate study that I read published last year by Luta et al. Available for free on PubMed. I'm going to link it to y'all if you're interested. It was a cool study. That study, sorry, I got mixed up. That study that I read cited the other studies that I just mentioned. I actually was not able to read any of those other studies that I had mentioned because all of them were behind a paywall. And I don't know if you've ever gone to read an academic work without some sort of subscription, especially if it's behind a paywall. But access to one article will run you anywhere from $20 to $40. I'm poor. I don't have very much money. So I'm not paying what would have been anywhere from $60 to $120 when I trust the validity of the study that I read that did cite those other studies. The study that I read in its entirety in 2025, or published in 2025 by Luta et al., that study found that 51% of their participants, all of which were lipedema patients, were obese. So, correlation, no causation. And that's, I did not anticipate that. I'll be very real with you. I genuinely assumed that it would be an obesity-caused disease and that there would have been clear causation, but that is not the case. We don't really know what causes lipedema. It's weird that way. Prevailing theories regarding lipedema are that it is hormonal or genetic. From what researchers can tell, lipedema will commonly flare up around, or begin or flare up, so begin or worsen, around time of major hormonal changes like puberty, pregnancy, and menopause, to name a few. Lipedema is an almost exclusively female condition. The most notable symptoms of lipedema are swelling, heaviness in the affected limbs, and pain. Other common symptoms include fatigue, mental health comorbidities, which is a fancy way of saying anxiety or depression caused by lipedema, and easy bruising. I thought that was interesting. Easy bruising. I didn't expect that. In addition to all of that information, lipedema is also very commonly misdiagnosed or underdiagnosed. We don't really have a solid understanding of lipedema's actual prevalence. Prevalence in epidemiology refers to the number of existing cases for a given condition. For example, in this house, the prevalence of being a certified patty is 100%. And it's incurable. Speaking of incurable, lipedema is a chronic condition that can only be managed, not cured, and management focuses on alleviation of its symptoms and preventing the condition's progression. According to the Lipedema Foundation, lipedema therapies or treatments, therapy and treatment are, we don't have to get into it. Lipedema therapies, or things you can do to help manage your lipedema, focus on managing inflammation, decreasing adipose tissue, so trying to lose fat, reducing fibrosis, improving lymphatic flow, prioritizing one's mental health, and improving one's overall health. The term reducing fibrosis, or when I say reducing fibrosis, that would be referring to therapies that prevent the lipedema fat from becoming hard and scarred, which is a way that the condition progresses. So not only does the fat continue to grow and accumulate, but the fat becomes hard and scarred, which can lead to other issues. Similarly, improving lymphatic flow refers to therapies that would increase circulation around the body and to the affected area. Common strategies for lipedema management that are promoted by doctors include weight loss or weight management, removing inflammatory foods from one's diet, wearing compression garments, mental health treatment or counseling as needed, and proper hydration. The main advice that they will give for management of lipedema will be to get enough exercise and prioritize low-impact exercise. Now that we understand what lipedema is, let's understand how it relates to Gorl World. The self-proclaimed queen of Gorl World, Amberlynn Reid, is very open about her lipedema diagnosis. She is out there destigmatizing and normalizing because she is a public health queen. That was a joke. She does not have any impact one way or the other on public health, but she does me a lot of favors by providing an easily accessible example of a public figure with lipedema and the impacts lipedema can have on one's life. Before we discuss Amberlynn Reid and her specific experiences with lipedema, let me let y'all know what I am not about to do. I'm not about to make fun of Amberlynn Reid. I will not make fun of her appearance. I will not make fun of her accent because listen to me, what room do I have? I will not sit here and attempt to poke holes in her story and prove that she is lying about these chronic conditions. I am not a reaction channel. I am a public health educator who is using an easily accessed public figure as an example when providing health education. If you want to see someone making fun of Amber's appearance or making fun of how she speaks or trying to prove that she's a liar who is faking every single health issue she has, there is no shortage of that content available on YouTube. But for the purposes of this video, I believe Amberlynn Reid when she says that she was diagnosed with lipedema and lymphedema. God, those are hard to say next to each other. Also, just like a side note, but I think that a lot of people, particularly people who create content in Gorl World, would benefit from taking a moment to think about the nature of this condition, because a lot of the conversation surrounding Amberlynn Reid's lipedema is pretty mean-spirited. They end up body shaming her a lot. And I'm not here to comment in defense of Amberlynn Reid, but I'm stating the objective fact that many of her commentary channels feel completely comfortable pejoratively discussing her body. And I think a lot of people think it's okay to shame Amberlynn Reid for her body because they believe that she is a bad person. Much better. Because they believe that Amberlynn Reid is a bad person, but there are many people with lipedema who have done nothing to deserve having their bodies made fun of. And it is a little bit of a transitive thing, right? So I just want to make that opinion known, just sort of like throw that out there. If you're making fun of Amberlynn Reid's body and how she looks, while knowing full well that part of it is because she suffers from this condition. Now, I'm not discounting the fact that she is the weight that she is. However, when it comes to her proportions, the distribution of her weight and things like that, particularly her legs and the lower half of her body, you are just making fun of the way people with advanced stage lipedema look. So just keep that in mind. So let's get into it. Amberlynn Reid was diagnosed with lipedema during her wifey era, which was the era wherein she was dating her ex-girlfriend. I think her name is Jade. I think Jade and wifey are the same person. I'm not 100% sure. That would have been following her cancer and her hysterectomy, not Jade's, Amber's, which happened during the Beck era, which is when she was dating the partner she had before Jade. Maybe 2 partners before Jade. I don't know. I'm not up in her business like that. I only just started following her like a year and a half to in 2024 sometime. When all of the crazy shit was happening, right? Like when Tommy was happening the first time, that's when I clocked in to the Amberlynn Reid factory unpaid. It actually makes sense to me that Amberlynn Reid would have been diagnosed with lipedema pretty shortly following her hysterectomy, or her cancer diagnosis, because she did at that time then have a hysterectomy a couple of years prior. And it's my understanding that Amberlynn had a radical hysterectomy, which is like a total hysterectomy. And it's quite an aggressive surgery. They take everything. They take the uterus, the ovaries, the fallopian tubes, the cervix, maybe even nearby lymph nodes and some of the upper part of the vagina if necessary. So that's kind of wild, isn't it? A radical hysterectomy would have sent Amberlynn Reid into an immediate menopause because she would have no longer had any estrogen producing organs left in her body. Your estrogen comes, I believe, from your ovaries. Once your ovaries are gone, there's no more estrogen. There is menopause, immediate menopause. It's called surgical menopause. Per Amberlynn Reid, she did go through menopause. Yeah, I mean, she's mentioned it multiple times. Amberlynn Reid did go through menopause following her hysterectomy, so that does make sense. Regarding symptoms of lipedema, Amberlynn consistently reports insecurities about her legs and the shape that they are. According to Amberlynn, her legs are the main thing that she is insecure about, and that is actually another very commonly cited experience by lipedema patients who commonly report feeling anxiety or depression regarding the way their condition causes their body to look. Amberlynn also consistently reports that her legs are sore or tender, which is another very common symptom, pain in the impacted areas. Amberlynn also has lymphedema, which is commonly developed secondary to lipedema as the condition progresses, and we'll get to more on that later. We did discuss a little bit ago what some commonly suggested methods of lipedema management are. Weight management or weight loss, as appropriate, are the main ones. There is a persistent myth that lipedema is not reactive to weight loss. That's not necessarily true. According to the International Lipedema Association, despite the fact that lipedema tissue is very stubborn and it will not go away from weight loss, which, you don't actually lose fat cells during weight loss. Your fat cells, you have the same amount no matter what. It's just that they shrink. So even though lipedema tissue is very stubborn and does not respond to weight loss the way that unaffected fatty tissue would, the condition lipedema is exacerbated, made worse, by excessive weight and obesity, so weight loss does help. And to bring it back to my best friend, Amberlynn Reid, anyone who has been following her for a while can tell you that she has not made any substantial lifestyle changes, or at least not permanently, nor has she lost any weight. Well, nor has she lost, she's wavered, right? She's waffled. She's lost, she's gained, she's lost, she's gained. So I would not say that she has maintained consistent, significant weight loss since being diagnosed with lipedema. As I understand it, Amberlynn Reid's highest weight was a few years before she was diagnosed with lipedema, but it's not like she got diagnosed and now she's a skinty legend. I'm sorry. I know I said I wouldn't make fun of her, but I don't think that is making fun of her. I think that that's just stating objective fact. Anyways, this all brings me to my next point, which is that a very common criticism in the Gorl world community that is levied against Amberlynn is that she uses her lipedema as an excuse to avoid losing weight or any accountability for her weight. My sort of hot take on the matter is I don't understand why everybody in Gorl world seems to care about Amber's weight. I understand that she started as a weight loss channel, and I understand that a lot of people started following her when she was primarily focused on weight loss, but it's been since I was in high school and I'm 30 years old, and it hasn't happened. So I don't understand why everybody is still playing in this space where Amberlynn Reid is a weight loss YouTuber, because that's just not true. My microphone. Sorry, I dropped you, but you're back now. So yeah, I just don't understand why people who aren't Amberlynn Reid really care about her weight. I understand why her direct loved ones care. I understand why people care in the empathetic sense or whatever, but there are people who are genuinely mad at Amberlynn Reid for not losing weight. You're not the one who has to live that experience or live in that body, so why do you care? Why are you mad? Why are you mad? Why are you mad at Amberlynn Reid for not losing weight? It's not your business. She's not impacting you. She impacts the people around her, but that's not you. And I think that even if Amberlynn Reid, here's a little hot take for you. I think that even if Amberlynn Reid were not as obese as she is, were not so profoundly overweight to the point of being quite disabled, I think she would still be taking advantage and manipulating the people in her life. So, like, again, the weight, like, I think it's just the tool that she uses. If it weren't her weight, she'd figure something else out. It's the easiest one. Anyways, so all of that, I'll play ball, right? I'll play ball with Amberlynn sort of saying or implying many times over the years that she cannot lose weight due to this condition. Would lipedema prevent a person from being able to lose weight? Yes and no. Lipedema can make weight loss difficult. There's no denying it. Lipedema tissue is very stubborn. Those fat cells are not easily shrunk. In fact, they typically won't respond or shrink through diet and exercise at all. More on that. The rest of the body will lose weight and shrink as expected, but lipedema impacted areas typically remain the same. But it doesn't make weight loss impossible, particularly for someone like Amber, who has access to weight loss medications multiple times. She's started them, and who would probably be able to receive weight loss surgery relatively easily. Different insurance plans have different procedures regarding weight loss surgery, but it's one of the most commonly performed surgeries in the United States. I had one, and I was able to figure it out, and I was 24 years old. Like, I was like peak stupid, and I was able to figure out getting weight loss surgery. So all it took was I had to do a 6-month weight loss trial. So for 6 months, same day every month, I had to go to the doctor and get weighed, and I had to weigh at least a teeny bit less than I had weighed last time. And that was really, really, really hard. That was really hard. I remember there was one time that I only weighed 1 ounce less than I had before. But, I had tried losing weight a bunch of other ways, and none of them had worked, which is why I had turned to a surgery in the first place. So, of course, I had a hard time with the weight loss trial. So I had to do that. I had to do a psychological evaluation, and I had to pay a $350 copay. My dad's in a union. I had good insurance. I'm 30. Not on his plan anymore. And now, you know what? My insurance is not that good. It's really not. I went to the emergency room, gave myself food poisoning. I was about to say I got a bad stomach bug. I know what happened. I gave myself food poisoning because I ate questionable vegetables that had been sitting in my refrigerator for like a week. I had sauteed them like a week prior, and I had sauteed them when they were already iffy. And that was stupid of me. But I did it, and I ate them. And then about 12 hours later, everything was happening to me. And after 3 days of everything is happening to me, I went to the emergency room because you can imagine I needed an IV desperately. And I just got a $750 bill. And my ER copay is only $100. So where'd that other $650? No, my insurance is not that good anymore. Anyways, obtaining the surgery, in my experience at least, is relatively easy. It's a relatively easy surgery to obtain. Most insurance plans will cover it. You just have to jump through hoops, but that's anything. In the United States, woo. Obtaining surgery is not the hard part. When it comes to a weight loss surgery, the hard part is recovering physically and mentally. The hard part is recovering and adjusting to a completely new life and a completely new relationship with food. Don't get me wrong, I still love food. But my relationship with it now is completely different. And I'm just talking up a fucking storm, aren't I? So, anyways, weight loss aside, right? Not everything is as easy as lose weight, but weight loss aside, some of the best strategies for managing lipedema per the Lipedema Foundation I think that's what they call themselves. International Lipedema Foundation. Yeah, just the Lipedema Foundation. So anyways, weight loss aside, some of the best strategies per the Lipedema Foundation for managing lipedema also include gentle exercise like walking, yoga, Pilates, or aquatic activities like swimming, water aerobics. Really good for you. Really, 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 really good for you. Popular opinion in the community, Amberlynn Reid does not participate in any of these, certainly not from what the viewers can see. Amberlynn Reid says she walks her dog, but she is not specific on how far or for how long. As an owner of 2 dogs myself, I feel like that is a pretty strong indicator of her not being necessarily doing a lot of walking of the dog. Probably she's just taking her outside to pee. I'm not going to sit here and like conjecture about the pee pads or whatever. All I'm saying is, in my experience, dog habits who are in the habit of like taking their dogs on walks, not just taking them outside to pee, the purpose of walking the dog is not using the bathroom. The purpose of walking the dog is enrichment and exercise. And these people who do that can talk about it for kind of a while. I could sit there and give you like a full rundown every day on my walks with my dogs. Probably take me about 10 minutes because I see cool stuff while I'm out there. But most people who, in my experience, most people with a dog who are walking their dogs, they have like a routine about it, you know, like they'll have regular routes and they will have like lengths of time and stuff like that. They'll do different walks for different times of day. For example, my dogs receive a short walk, a regular walk, and a long walk. There are those 3 options. A short walk is about 15 minutes, a regular walk is about 30 minutes, and a long walk is 45 minutes or more. And each of these options has about 3 or 4 different routes to choose from, because it's also good for your dog to get onto a different route every day, smell new stuff, see new things. Enrichment. Other than walking Twinkie, Amberlynn Reid does not report participating in any exercise. If she were to begin walking regularly for exercise, it would be really beneficial to help her manage her lipedema, as it would increase her mobility, decrease her fatigue, help her to manage her pain, as is the case for most lipedema patients and most people in general. It's a really commonly held belief that if your legs are bothering you, you should not be walking. Unless your doctor tells you don't walk, you should be walking, especially if your legs are bothering you, if you have like joint problems, like if you have arthritis in your knees, one of the best things you can do for them is walk. And we'll get more into why in a second. Something that I think is worth noting is that Amberlynn Reid does actually know that is the case. That gentle exercise and movement are beneficial to her pain management.
Yeah, it's my appointment for my leg. As you guys know, my whole leg issue has been going on. And today is actually the first day where it's felt pretty good. Like, it doesn't hurt as bad as usual, which is really crazy to me. But I think it's because I have been moving more the last few days. I've been just doing a little bit more walking than I usually do.
She has undoubtedly been counseled on it if she has seen a doctor or other health professional for management of both lipedema and lymphedema. There's no way that they have not told her that it's good for her to get out and get a walk. That would be irresponsible care. The other condition that Amberlynn Reid frequently cites having is a condition called lymphedema. I also did not know what lymphedema was prior to becoming a Gorl World viewer. And so now that I've enlightened myself, as Amberlynn Reid so kindly encouraged me to, I will enlighten you, the viewer. Ooh. I almost knocked you over. That would have been bad. So, lymphedema. Lymph is the name for a system in the human body that contains the lymph nodes. And edema is the word for fluid buildup and swelling in the body. Lymphedema is the word essentially for swelling under the skin caused by lymphatic fluid buildup. The lymphatic system is a series of nodes and vessels that carry lymph fluid throughout the body. It is a part of our immune system. When we get an infection or we get sick, our lymph nodes serve as a filter for the bacteria or virus that is making you sick, trapping the pathogen in the node, which makes the node swell. Which is why when you go to the doctor for a sore throat, they touch your neck. Because if you touch your neck right here below your ears, and it feels kind of tender, you have lymph nodes there. And when you go to the doctor and they're kind of just like touching up on you, it's because they're checking to see if your lymph nodes are swollen. It's normal to be a little tender, but if you touch it and you feel something there, like you shouldn't really feel any like lump or anything. So if you touch it and you feel a lump, keep an eye on that. Keep an eye on that. Tell a professional. I'm laughing, but I'm serious. I actually loved researching this video. The lymphatic system is so cool, and I really did not have as solid of an understanding of it before I started researching this video. I look just like a big lump. Cool. Anyways, humans have anywhere from 400 to 800 lymph nodes throughout our bodies, which is awesome. It varies from person to person. That's cool too. They are spread out throughout our body in little clusters. So like clusters of like, a lot actually. I was about to say like 4 to 5, but it's got to be more than that. If you have anywhere from 400 to 800, like that's a lot of little clusters. They're spread throughout our body in little clusters. Major clusters are located in the neck, kind of like down here, behind your ears, right here, in your abdomen, just throughout, and in your pelvis, and in your groin. Oh, and there's lymph nodes right here at the base of your skull. And I was very interested to learn that because every time I get sick, like with allergies or I get a cold or something like that, I get a really, really stiff neck. And it's so painful. And it's the worst part of being sick for me. If I just have like a small infection, the stiff neck, that's the worst part for me. And now I know that it's probably swollen lymph nodes, and I'm hoping that next time I get sick, that symptom won't bother me so much, since I'll know that it is a sign that my body is working to help me get better. Thank you, body. I appreciate it. I genuinely appreciate it. I will reward you with a walk and some water and some butter noodles, because we need balance and I really want some. Oh my God, I want some butter noodles. Anyways, lymphedema is caused primarily by damage to or removal of the lymph nodes. Do you remember how I said during radical hysterectomies, they may even take some of the lymph nodes in the abdomen or in the groin? It's all coming together. This is because after there is damage or removal of the lymph nodes, there is decreased ability of the lymph vessels, which are like blood vessels, but for your lymph, to drain lymphatic fluid into the node where it can be filtered and pumped back through muscle movement. Very important that you understand that. Your heart pumps blood throughout your blood vessels all the time. You don't have to do anything. You don't have to think about it. For your lymphatic system to work, you must move your muscles yourself. For lymph to be able to be pumped throughout your body and throughout the lymph vessels, the muscles must constrict the vessels. Nothing is coming to do it for you. You have to do it. So next time you don't want to get on a walk, next time you don't want to go to the gym, next time you don't want to do 20 push-ups and then watch me do 21 push-ups because I'm always going to do one more push-up than you, you just tell yourself, like, I have to for my lymphatic health. That's so bullshit. But I mean, it is true also. But like, it wouldn't work on me either. Primary cause, number one primary cause of lymphedema is damage to the lymph node or the lymphatic system. The most common cause of lymphedema per the University of Texas MD Anderson Cancer Center is cancer treatment, actually. It's really hard on the lymphatic system. Cancer treatment. Amberlynn Reid was diagnosed with lymphedema after her hysterectomy, which, again, I could be wrong, but it was probably a radical hysterectomy because that's commonly what they would use to treat early stage uterine or ovarian or any sort of female reproductive cancer. I bring this up because, as I previously mentioned, a radical hysterectomy is a pretty aggressive surgery. This would include, like I said, complete removal of the uterus, the fallopian tubes, the ovaries, the cervix, sometimes the upper portion of the vagina, and frequently nearby lymph nodes. According to, now I did think this was, I know I said I would make fun of Amberlynn Reid, and I don't think that it's the wisest move to publicly declare myself a public health professional here, which I am one, and then a little bit make fun of Amberlynn Reid. But I did think it was very funny when researching this video that she said that she had self-diagnosed herself with lymphedema. And I want to clarify that that was the phrase that she used, and that's just part of why I thought it was funny, was that she said, I self-diagnosed myself. Like, okay, girl. You don't gotta say it twice. Per Amberlynn Reid, she self-diagnosed herself with lymphedema. She mentioned it to several doctors, and any of them said anything about it to her or counseled her about it at all. Which, bigger if true, and it did not happen in an emergency department setting or in another specialist setting. I find that very hard to believe, especially because Amberlynn Reid is someone who is known to not utilize primary care and primarily see a physician through the emergency department, which is a massive strain on the American public health, on the American healthcare system. Don't do that. If you can avoid doing that, then don't do that. I know I just said I went to the emergency room because I had a really bad stomach bug, but they can't give me an IV at the urgent care. And if they could, that's where I would have gone. They don't do needles at urgent care. Not the ones by me, at least. Believe me, buddy, I don't want to go to the emergency room. But I'm not about to pay over $100 for an IV. And I don't think that they could give me Zofran at an IV clinic. Instead, I'll pay $750 per Amberlynn. She finally did go and see a doctor about her leg. I guess she was fearful that she had a blood clot, and she was referred to a lymphedema and lipedema specialist. She also calls it lipedema, but it is pronounced lipedema, but she's not wrong. I get why she would have thought it was lipedema at first, because we say lipase and stuff. It's not consistent. We say lipase, we say liposuction. So that's not on her. I see the confusion there. Now, this is... Amberlynn says that the specialist told her that she was having lipedema and that she was having lymphedema as secondary to lipedema. I could have done more in-depth research into Amber's specific experience, I guess, but she cleared her channel, so all I have to go off of is compilations now. In the research that I did, I don't believe that Amberlynn Reid left her specialist appointment with a solid understanding of what lymphedema, oh my God, she's doing it to me now, what lipedema and lymphedema are and how to manage them, because she was not doing a good job of explaining. But, that is like a skill. That's a skill that I went and I got a master's degree for, is like understanding complicated medical information and then explaining complicated medical information. And so, I get why Amberlynn Reid maybe can't do that. It's a pretty specialized skill, but when I was watching it, the health educator in me was like, oh, if I was hearing you say this to me, I would have we would have gone over some things, because I was not confident that she had a solid grasp on it, and this is important information. Amberlynn Reid said that she has had big arms and big calves her entire life, citing lipedema as the source. I mean, maybe. I will say Amberlynn Reid's arms are proportionally large, in my opinion. And actually having big calves is not typical lipedema presentation. Lipedema typically would not build up in the lower extremities, so like below the elbow, below the knee. It's more commonly in the upper extremities, the torso, and like I said, the area between the navel and the knees. That's what's most commonly and most severely impacted by lipedema for the vast majority of people. Amberlynn's doctor tells her that she is this is where I think that Amberlynn Reid did not have a solid understanding of her condition. Her doctor tells her that she's having trouble losing weight because of the lipedema, probably true. And, like I said, probably true. Lipedema tissue is notoriously stubborn. Something that I found interesting is that per Amber, her doctor asks her if she's had trouble losing weight and, quote, even eating a normal amount. And Amberlynn responds positively, acknowledging yes for both. Lipedema would not cause issues with overeating. Lipedema is it is not. It's not something that's going to, in all of the research that I did at least, I mean, all things are possible. I did not find anything on the Mayo Clinic, on the Cleveland Clinic, on PubMed, on the CDC's website. I was on the UPenn website. I was on the Drexel Health website. Like, I'm looking at reputable sources that I used in graduate school that I trust. Not a single one of them mentioned impacts to the metabolism or the appetite. That's all I'm going to say. Where Amberlynn Reid reports of a doctor says that she has a difficult time controlling the amount that she eats because of this lipedema, or that's at the very least how Amber presents it. I'm pressing X and I'm doubting. I'm doubting that that's how the doctor phrased it. I'm sure that that's how Amberlynn interpreted it. Amberlynn Reid and her doctor both acknowledge that she eats above a normal amount, quote unquote normal amount, let's say 2,000 calories, which is the standard amount for most adults. So let's say, Amberlynn Reid and her doctor both acknowledge that she's eating above 2,000 calories per day. And, well, you need to eat in a calorie deficit to lose weight. You cannot lose weight if you are not, it's physically not possible to lose weight if you are not expending more calories than you consume. It simply is not possible. And I don't say this to be insensitive. I say that as someone who really genuinely gets it. I say that as somebody who has massively struggled to lose weight, who had permanent life-altering surgery in order to achieve weight loss, and who still has a really difficult time achieving that last little bit after the effects of the surgery wore off, because you do eventually sort of reach a level out. And I leveled out about 15 pounds heavier than my goal. And losing that last 15 pounds, very difficult. I really sympathize with Amber. I really sympathize with Amber when it comes to the difficulty of losing weight. I don't understand why she continues to make the choices that she does, but when it comes to just like, oh my God, this is so hard, I get it. To lose weight, one must reduce their calories to a level below what they burn in a day. That's like thermodynamically how calories work. And it's actually really, 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 really hard to burn enough calories to make up for a poor diet. And that's always been the hardest part for me. It's really, really hard to burn enough calories to make up for a poor diet. Diet is all of it. I know they say diet and exercise, but it's mostly diet. It's like 90% diet, maybe less, but shit, maybe even more. A favorite sweet treat of mine, a Snickers bar, I love a Snickers bar, is 250 calories, which is a lot. It's a lot. And to give you context, or to sort of like bring my point home about how it's really hard to exercise off a poor diet, one Snickers bar, 250 calories, kind of hurts my teeth a little bit. I'm getting older too. So, I mean, there's a couple of reasons I don't get them very much. And they're always hard. I go to Wawa, I get a Snickers bar, rock fucking hard. What's that all about? 250 calories, which takes up to an hour of gentle exercise to burn off. So you go to Pilates class. You go to Pilates class afterwards. You go to Wawa. You get gas. You get yourself a Snickers bar. It's, again, rock fucking hard, but you eat it anyways. You have undone your Pilates class. You have undone your Pilates class. You have to cut out I'm just talking to myself now. I'm looking at myself in the viewfinder and I'm talking to myself. Stop going to Wawa after Pilates. Stop. Anyway. This is so fun. I love just sitting here talking absolute bullshit to myself. Amberlynn seems to have left that appointment with the specialist believing that she is not able to lose weight because of her disease. And that's just not true. And that's why I was frustrated watching it. Lipedema, again, it makes it really difficult to lose weight, but it's not impossible. Amberlynn acknowledges that she struggles with overeating and with poor dietary choices. That's why. And I know what everybody in the community says, and I know that I'm like not the first, nor the second, nor the first 100th, nor the second 100th person to say this to and about this particular individual, but that's why. She blames the disease on her reaching her size that she's at and her inability to lose weight, but her viewers see that she is inconsistent in her weight loss efforts, and particularly her diets. At one point, Amberlynn Reid quotes her doctor as saying, "Lipedema is a disease that progresses. It doesn't just stop." Amberlynn says that is her aha moment, and she now understands the why of her size. Amberlynn reported that she was counseled by her doctor to begin a low carbohydrate diet, sticking to under 50 grams of carbohydrates a day as the best method to lose weight and manage her lipedema and her seemingly secondary lymphedema. That has not happened. We all know that hasn't happened. Everybody knows that has not happened. And I feel like I'm being a bitch, but it is just the genuine truth. So it seemed to me, the viewer, that Amberlynn Reid left her appointment with the specialist with a baseline understanding of her condition, which is good and important, and a better understanding than she had before. But she lacked a thorough understanding, and she seems to have filled in some gaps herself, which is fine. It's not her fault. I'm not mad at her about it. It's just unfortunate that seemingly Amber's takeaway from her appointment with the specialist was, you can't lose weight because you have this disease, instead of you have this disease, which means your best method of losing weight is this specific method. So, in recent Lol Cow Bus episodes, Amberlynn Reid has harped on others for being responsible with their YouTube platform and told them that they need to understand that they have a platform and people are listening, and that they take what she says to heart, or they take what they say to heart. The other hosts, not her. Geez, I say recent, but this would have been weeks ago now. And they do it every day, which is crazy. I actually agree. I think it's important to be very careful with any platform that you might have, and that you should really consider your impacts on others, which is part of why I find this also frustrating. I worry that Amberlynn Reid platforms the idea that a person with these conditions cannot self-manage them and cannot lose weight, and that is not accurate. I would request that Amberlynn Reid do the same thing with her own platform and avoid perpetuating the idea to other lipedema and lymphedema patients that there is nothing that they can do to manage it, because there are many options. There are many, many options, and kind of like, there you have it. Lipedema is a chronic condition causing buildup of fatty tissue in the limbs and trunk, most commonly in the lower body. We don't really know what causes it, but it's probably genetic and/or hormonal. Lymphedema, is a chronic condition causing buildup of lymph or lymphatic fluid in the body, and it's most commonly caused by damage or removal of parts of the lymphatic system, most commonly caused by cancer or cancer treatments. Lymphedema can also be caused by lipedema in its advanced stages. The best methods of managing lipedema and lymphedema are gentle exercise, a balanced low-carb diet, and weight loss. Amberlynn Reid suffers from both of these conditions, though she does not seem to fully grasp how to manage them. That's it, really. If you've watched to this point, thank you. I really appreciate it. My channel art was done by my very talented friend, Randanopteryx, and I will link their information in the description. My intro and outro little stingers were made by another very talented friend of mine, and I will link his information in the description as well. I enjoy public health, I enjoy pop culture, and I make videos combining these two interests. And that's really it. Thank you so much for watching. I feel like I am leaving a voicemail. I talk to a lot of medical providers for my work, and I leave a lot of voicemails because medical providers don't like to answer the phone, and I sound like how I sound when I leave a voicemail. Like, thank you so much. Have a good day. Have a good weekend. Talk to you later. Bye.